National Primary Healthcare Development Agency, in conjunction with World Health Organization, today held a joint press conference in Abuja. Executive Director and CEO of Primary Healthcare, Dr. Faisal Shaibu, noted that 53.2% of Nigerians have been vaccinated. However, he noted that Kogi State has flagged off her vaccination program at 16,900 doses of vaccine was allocated to the state.
I welcome you all to this update on COVID-19 vaccination in Nigeria. I am pleased to inform you that the vaccination process across the country is happening according to plan. Even the initial challenges experienced by Kogi State citizens in accessing the vaccines has been resolved by the Presidential Steering Committee on COVID-19. As you are aware, about 16,900 doses of the AstraZeneca vaccines was delivered to Kogi State, and they have since launched their COVID-19 vaccination program. We are gratified to say that it is going very well. As of today, April the 16th, 1,071,346, representing about 53.2% of the eligible persons targeted with the AstraZeneca vaccine have been administered their first dose of this vaccination in this vaccination phase. It is important to note that these data are based on reports received from states through the electronic management of immunization data systems only, and do not take into account vaccinations that are not yet captured in the system. What this number means is that these are the people who have their information already uploaded onto our database, while others are awaiting upload, potentially due to network problems and the high traffic of those coming in to take their shots at the same time. While we continue to optimize our registration and immunization data system, we also encourage the state teams to deploy the most suitable internet service for their locations in order to speed up the data entry process so that we can have the actual number of vaccinated people at any given time. In many states, we have completed inoculating frontline health workers and are now offering vaccination to the elderly, particularly those that are 65 years and above. We are glad to be able to progress quickly and offer immunization to more members of the community. Our rollout has been marked by safety, efficiency, best practice, and speed. I want to take this opportunity to thank all our health workers for their incredible and tireless commitment to making this work. The National Primary Healthcare Development Agency and its development partners have a platform of senior supervisors that engage in daily evening review meetings to determine the status of the COVID-19 vaccine implementation in all states and the FCT. These meetings are an opportunity to get reports from the subnational level on how the campaigns are proceeding, what challenges they face, how we can proactively anticipate and resolve any impending challenges, and also troubleshoot to address real-life operational hurdles to our execution plans. We have been careful to ensure that only those who are eligible to receive the COVID-19 vaccine in the current phase are vaccinated. These include health workers, their support staff, other frontline workers, strategic leaders, and in the last few days, we have also included those who meet the age requirements. We continue to communicate this eligibility criteria to our teams in the states in order to address earlier misunderstandings around people who are being vaccinated across the country. There is currently a global shortfall of COVID-19 vaccines, largely due to the manufacturers not meeting their projected targets. We are also witnesses to vaccine nationalism that has led COVID-19 vaccine producing countries to restrict exportation and protect vaccines for their citizens. These developments have now necessitated that we reassess our vaccine supply forecasts and take the decision to ensure that everyone who has taken the vaccine in the current phase gets the second dose before the next consignment is delivered to Nigeria. Furthermore, as a result of this overall program review to meet the challenges of global vaccine demand and supply mismatch, and the late commencement of the vaccination in some states, we are expanding the eligibility period between the first and second doses of the vaccine from 12 weeks to between 8 to 12 weeks. This is in line with the scientific recommendation provided by the World Health Organization's Strategic Advisory Group of experts that the 2 doses of this vaccine can be given at an interval of 8 to 12 weeks. At this juncture, I would like to provide an update on the vaccine accountability issues that erupted in Falomo Clinic, Lagos State. There has been a rich engagement with the governor of Lagos State and his health team led by the Honorable Commissioner for Health. A rapid fact-finding team was established to investigate the veracity of these reports, not only in the said Falomo Clinic, but in designated health facilities all over the state. The information reaching us is that these reports of widespread mismanagement of the vaccination process were inaccurate and do not represent what transpired in these locations. One thing that the Presidential Steering Committee and the Lagos State government are aligned behind is zero tolerance to diversion of COVID-19 vaccines. The vaccine is free to all Nigerians irrespective of social standing. The current batch of vaccines were made available courtesy of the COVAX facility to ensure equal access to the COVID-19 vaccines by all countries. Equity, fairness, and social justice is at the core of why COVAX was established. For us at the Presidential Steering Committee and the Federal Ministry of Health, these are our guiding principles, our North Star, as we distribute and administer the vaccines to all our beloved citizens. Let me seize this opportunity to acknowledge that we are not unaware of attempts by individuals who are not eligible to access the vaccines. With willing accomplices, it will not be surprising that some may succeed. When people skip the eligibility lines we have established to access the COVID-19 vaccines ahead of frontline health and other workers, then they should ask themselves if this is ethically and morally right to jump the queue ahead of those who need the vaccines the most. In anticipation of this, we have deployed structures and personnel to ensure these acts are minimized to the barest minimum. On this note, I wish to commend the chairmen of the ICPC and the EFCC and their personnel for the enthusiasm and dedication with which they have joined our quest for vaccine utilization, transparency, and accountability. Permit me to once again draw your attention to the fact that the federal government of Nigeria, through the Presidential Steering Committee, has only one channel of distributing the COVID-19 vaccines to all Nigerians. It is very important for the general public to be mindful that the ongoing vaccination is only available in designated health centers as structured by the National Primary Healthcare Development Agency, which is the primary agency under the Federal Ministry of Health, charged with the responsibility of all vaccine-related matters in collaboration with the state ministries of health and the state primary healthcare boards. The safety of Nigerians is paramount. We hold this responsibility as a sacred trust. Therefore, Nigerians should be rest assured that working with NAFDAC, NCDC, and other related agencies, we have a well-guarded and strictly compliant system to ensure that no unauthorized or counterfeit processes are introduced from foreign countries. There are also developments in the international community which some of you may be following. But even if you are not, I want you to be informed. Europe's medical regulator, the EMA, recommends that Oxford AstraZeneca, the vaccine being administered here in Nigeria, is administered to all populations and age groups, and it is currently being administered in Europe following a temporary pause last month to allow the EMA to examine the potential rare side effects of blood clotting. The EMA completed its review, and Oxford AstraZeneca is now being used again. The European Union has had a challenging time getting its vaccination program off the ground, and we wish them well. As you can imagine, it is incredibly complicated to organize collective policy among many nations. The UK has decided to pause administration of AstraZeneca to the population of 18 to 29, following an investigation into rare incidents of blood clotting. Europe, however, is administering AstraZeneca to all age groups following its own investigation into the blood clotting incidents. The World Health Organization strongly recommends the continued use of AstraZeneca for all age groups, and its top scientists advocate for its safety. The calculated benefits of the COVID-19 vaccine far outweighs the risks. When incidents, no matter how rare, appear in populations receiving the vaccine, relevant authorities must investigate to determine whether there may be a connection between the medical incident and the vaccine. At this stage, different countries are taking different approaches. In Nigeria, since the vaccination program was officially rolled out on the 15th of April 2021, a total of 8,439 mild adverse events following immunization (AEFI) have been reported. These range from pain, swelling at the site of the inoculation, to body pains and nausea. Similarly, 52 cases of moderate to severe incidents of AEFI have been reported. These presented as fever, vomiting, diarrhea, headaches, dizziness, and allergic reactions. 5 states have the highest records of the mild AEFI, namely Kaduna 970, Cross River 859, Yobe 541, Kebbi 511, and Lagos 448. there has been no deaths from administration of the vaccine. We have also not diagnosed any case of blood clots related to the administration of the AstraZeneca vaccine. Nevertheless, we are working with NAFDAC, NCDC, and the academia to set up a more active surveillance system which is built on our experience with polio surveillance. We have said from the start, and I'll say it again, we will only administer vaccines to Nigerians that are both safe and effective against COVID-19. We will continue to follow international best practice and advice of the World Health Organization and other leading international regulatory bodies throughout this process. In the coming few weeks, in collaboration with the states, we plan to engage more at the community levels across the country by organizing zonal town hall meetings to facilitate the discussions around COVID-19 vaccination in Nigeria. We believe that it is the right of Nigerians to get the correct information about COVID-19 vaccines, so they have the right education, the right information to make the right decisions about taking the vaccine. The proposed dates and venues for these zonal town hall meetings are as follows. For North Central, it will be in Lafia, Nasarawa State on the 20th of April by 10 a.m. And the Northeast, it will be in Yola, Adamawa State at a date to be confirmed. In the South-South, it will be in Asaba Delta State. The dates will be communicated. Northwest, it will be in Kano State. In the Southeast, it will be Owerri in Imo State. Again, the date will be confirmed and communicated. In the Southwest, it will be in Lagos State at a date to be communicated. So we thereby invite you all to join us at these town hall meetings. So far, credible and respected Nigerians from the traditional, religious, and academic sectors have continued to lend their voices and support to the vaccination efforts by receiving their first dose of the COVID-19 vaccine and testifying to its benefits. This will go a long way in encouraging their adherents to also take the vaccine, promote herd immunity, and protect our communities. Let me end by appreciating you all once again for your commitment to our collective determination to protect Nigerians against COVID-19. You have not relented in educating Nigerians and keeping the world abreast of government's efforts to protect its people against COVID-19. Please keep it up.
It started, and more than 200 million doses, even more, have been administered. But it's only 10 countries which have less than 50% of the global population that have managed to acquire and distribute over 80% of the vaccine available. And some countries are even storing, keeping the vaccine for possible future use where other countries are yet to access. For Nigeria being among those few countries outside that group, to get the vaccination underway is really commendable, and I want to recognize this. The second thing I wanted to do this afternoon is to complement observation remark by the Executive Director and PACDA. And I want to focus mostly on the safety side of the AstraZeneca vaccine. As you know, in response to a small number of rare type of thromboembolic events, the blood clot with low platelet counts, in those who have had the AstraZeneca vaccine in Europe, in the UK, the WHO Global Advisory Committee on Vaccine Safety, the European Medicine Agencies, and the UK's regulator, the MHRA, have been reviewing all the available information and data to establish a causal link between AstraZeneca vaccine and those events. On 7th of April, the Global Advisory Committee of WHO, the UK regulator, and EMA issued statement, as you know, all concluded that the benefit of taking the AstraZeneca vaccine outweighed the risk. WHO advises countries should continue to vaccinate with AstraZeneca vaccine, which has saved millions of lives and prevented several illnesses. As you know, all the vaccines being rolled out so far are close to 100% effective when it comes to preventing severe disease and death. And that should be our real objective as we roll out this vaccination program. To date, over 200 million doses of AstraZeneca vaccine have been administered. About 182 cases of thromboembolic events with thrombocytopenia have been reported. If there is a causal link, the events are very rare and the risk is extremely low. A number of fatal cases were reported. However, in comparison, as of 7th of April, 2.86 million people worldwide have died of Covid-19, and the infection continues to rise. The Global Advisory Committee on Vaccine Safety of WHO advised that as causal relationship between the vaccine and the occurrence of rare blood clot with low platelet count is considered plausible but not confirmed. More data from regions outside Europe and UK are needed to fully understand the potential relationship between the vaccination and those events. And we've heard from ED, no such event have been documented in Nigeria, even as we've reached over 1 million population vaccinated. The Global Advisory Committee on Vaccine Safety emphasized that while concerning, the events under the assessment are extremely rare and should be assessed against the risk of death from COVID-19 disease and the potential for the vaccine to prevent infection and reduce death. Accordingly, the benefit of the vaccine still far outweighs the risk, and the WHO advice as to who should be vaccinated with AstraZeneca vaccine remain unchanged, as ED, as mentioned, is in statement.
Michael Chidi, reporting for GTV Africa, Abuja.